Hello and welcome. Today we are going to learn a very important skill, how to measure blood pressure manually. This technique is a cornerstone of health assessment. Knowing how to do this can be incredibly valuable. It helps us understand what is happening inside the body. Manual blood pressure checks are still very important. Even with modern digital devices, this skill is key. Healthcare professionals rely on it for accuracy. It allows for a deeper understanding of a patient's condition. Sometimes digital machines can give varied readings. Manual checks help confirm these readings. They are also vital in areas with limited technology. Learning this skill empowers you. It gives you a fundamental tool for health monitoring. This guide is designed to be easy to follow. We will break down each step very carefully. You will soon feel confident in your ability. Let's begin this important and rewarding journey. Embrace the learning, and you will succeed. To measure blood pressure accurately, you need the right tools. The main instrument is called a sphygmomanometer. This is the device with the cuff, pump, and gauge. You will also need a good quality stethoscope. This helps you listen to the blood flow sounds. And very importantly, you need a quiet environment. Let's look at each of these tools more closely. The sphygmomanometer has three main parts: the inflatable cuff, the rubber bulb, and the pressure gauge. Familiarize yourself with these parts before you start. Next, you will need a stethoscope. For blood pressure, it helps you hear the Korotkoff sounds. Ensure the earpieces fit comfortably and point slightly forward. A good stethoscope makes a big difference in what you can hear. Finally, a quiet environment is crucial for accuracy. Measuring blood pressure requires careful listening. Background noise can make this very difficult. Distractions can lead to inaccurate readings. So, always try to find a calm and quiet space. Ask the patient not to talk during the measurement. This simple step greatly improves the reliability of your readings. So what exactly is blood pressure? It is the force of blood pushing against the walls of your arteries. Arteries are blood vessels that carry blood from your heart to the rest of your body. Your heart pumps blood with each beat, creating pressure. Think of it like water flowing through a hose. Blood pressure works in a similar way inside your body. It is a vital sign that tells us a lot about your health. Monitoring blood pressure is very important for health. High blood pressure or hypertension often has no symptoms but can silently damage your organs. Low blood pressure or hypotension can cause dizziness or fainting. Regular checks can detect issues early. Knowing your numbers helps you take control of your health. When you get a blood pressure reading, you see two numbers. The first or top number is the systolic pressure. This measures the pressure in your arteries when your heart beats. The second or bottom number is the diastolic pressure. This measures the pressure in your arteries when your heart is at rest. Together, these two numbers give a snapshot of your blood pressure. For example, a reading might be 120 over 80 mmHg. Understanding both numbers is crucial for a complete picture. Section 4. Preparing for success. Getting the patient ready. Proper patient preparation is essential for an accurate blood pressure reading. If the patient is not prepared correctly, the reading can be wrong. This could lead to incorrect diagnosis or treatment. The patient should feel comfortable and relaxed. A calm state helps give a true reflection of their usual blood pressure. Explain the procedure to them briefly to reduce anxiety. Before taking the measurement, the patient should be relaxed. Ask them to sit quietly for at least 5 minutes. They should avoid caffeine, smoking, or vigorous exercise for at least 30 minutes prior. Ensure their bladder is empty. Choosing the correct arm is also important. Usually blood pressure is taken on the left arm. The arm should be bare. Ask the patient to roll up their sleeve. Make sure the clothing is not tight or constricting on the upper arm. The patient's position during the measurement is critical. They should be seated comfortably in a chair. Their back should be supported by the chair. Their feet should be flat on the floor, not crossed. The arm you are using should be supported and at heart level. Correct positioning is key. Section 5. The art of the cuff and stethoscope. Proper application. Applying the blood pressure cuff correctly is a vital step. An improperly placed cuff will lead to an inaccurate reading. The goal is to ensure the cuff can evenly compress the brachial artery. Take your time with this step to get it just right. First, you must choose the correct cuff size for the patient's arm. Cuffs come in different sizes: small, medium, adult, large, and sometimes thigh cuffs. The inflatable bladder inside the cuff needs to be the right proportion. If the cuff is too small, the reading will be falsely high. If the cuff is too large, the reading will be falsely low. Always check this before applying the cuff. Wrap the deflated cuff snugly around the patient's bare upper arm. The lower edge of the cuff should be about 1 inch above the elbow crease. Most cuffs have an artery mark that should be aligned with the brachial artery. The cuff should be snug enough that you can fit 2 fingers underneath it. Next, let's talk about using the stethoscope. Place the earpieces of the stethoscope into your ears. They should be angled slightly forward. Place the chest piece of the stethoscope over the brachial artery just below the cuff's edge. Do not place the stethoscope head underneath the cuff. Hold the chest piece firmly against the skin. Section 6. Taking the reading, a step-by-step guide to precision. Now we have reached the crucial part, taking the actual reading. You have prepared the patient and correctly applied the equipment. Remain calm and focused throughout this process. Ensure the patient is also quiet and still. This part requires careful listening and observation. You will be inflating the cuff, then slowly deflating it. While deflating, you will listen for specific sounds and watch the gauge. First, you need to estimate the systolic pressure. To do this, feel for the radial pulse at the patient's wrist. Close the valve on the rubber bulb and rapidly inflate the cuff. Note the point on the gauge where the radial pulse disappears. Then, inflate the cuff about 30 mmHg higher than this point. Now you are ready to deflate the cuff and listen. Place the bell or diaphragm of your stethoscope over the brachial artery. Slowly open the valve on the bulb and deflate the cuff at a steady rate. The recommended rate is about 2 to 3 mmHg per second. As the pressure in the cuff drops, listen carefully for the Korotkov sounds. The very first clear tapping sound you hear is the systolic pressure. The point at which the sounds completely disappear is the diastolic pressure. Once the sounds are gone, deflate the cuff completely and quickly. Section 7. Avoiding pitfalls in charting for clarity, ensuring reliable results. Even with careful technique, common mistakes can occur. Inaccurate readings can have significant consequences for patient care. Let's discuss some frequent errors. One major pitfall is using the wrong cuff size. A cuff that is too small will give a falsely high reading. A cuff that is too large will give a falsely low reading. Always measure the patient's arm circumference if unsure. Incorrect cuff placement is another common error. Ensure it is snug and the artery marker is correctly positioned. Deflating the cuff too quickly is also a frequent mistake. Remember the 2 to 3 mmHg per second deflation rate. Other mistakes can involve the patient or the environment. Ensure they are relaxed, quiet, and properly prepared. Incorrect arm position, not at heart level, will alter the reading. Background noise can interfere with your ability to hear the Korotkov sounds. Always seek a quiet environment for the measurement. Finally, after taking the reading, you must record the results accurately. Write down the systolic pressure over the diastolic pressure. Also note the date and time of the measurement. Consistent and accurate charting allows for tracking blood pressure over time.